Le sida est une maladie.
AIDS is caused by a virus called HIV. HIV can be prevented through the use of condoms during sexual intercourse, the use of sterile needles or syringes, and the use of safe blood during transfusion. HIV infection can also be reduced through male circumcision, while the administration of ARVs to mothers living with the virus can largely reduce HIV transmission to their child during pregnancy, childbirth and breastfeeding.
Le postpartum et l'allaitement.
L'usage des préservatifs est très efficace.
The use of condom is very effective in preventing sexually transmitted infections in general, particularly HIV, the virus that causes AIDS. Even married couples can use condoms because this protects them from contracting sexually transmitted diseases. So it's always beneficial, even if circumcised, to use condoms.
Male circumcision is a surgical procedure that is conducted on males to remove the foreskin on the penis. Males who are circumcised have a 60% protection from female to male transmission of HIV. So we still have to worry about the 40%. This is why even after you've been circumcised, you still need to use condoms.
Mothers who are living with HIV can infect their babies during pregnancy, childbirth, and breastfeeding. By taking ARV medicines, they can prevent their children from getting the virus.
It is not good to be reluctant when it comes to undergoing an HIV test during pregnancy. This can lead a mother to transmit HIV/AIDS to her newborn baby. The result of it all will be deterioration of a mother's and child's health, which would have been avoided if a mother had visited a health center for a prenatal HIV test. If diagnosed with the disease, the mother would get drugs and put under PMTCT to ensure the baby in the womb is safe from HIV infection.
The response of the health sector is based on four main strategies. 1. Primary prevention of HIV infection in women who can have children. 2. Prevention of undesired pregnancies in mothers living with HIV. 3. All HIV pregnant women should receive ARVs to prevent HIV transmission to their baby during pregnancy, childbirth, and breastfeeding. 4. All pregnant women and their children should receive appropriate care.
The use of ARVs for preventing mother-to-child transmission of HIV is essential. In addition, achieving early infant diagnosis of HIV is critical to identify those children who may get infected. Once a child is diagnosed with HIV, immediate initiation of ARV therapy is recommended by the World Health Organization. If the HIV infection is not diagnosed early, 30% of the children who are infected die within the first year, and 85% of them die before they reach the age of 5 years.
The earlier someone starts treatment, the better the outcomes in terms of adherence, in terms of better quality of life, and also it is less costly because these people have fewer opportunistic infections such as tuberculosis. The response to the epidemic in the African region is still hinged on prevention. Yes, we've got life-saving medications to treat those that need them, but we have to reduce the number of new infections that are occurring in our region. We need to keep those who are infected alive. And we also have to use the existing tools to make sure that we have fewer and fewer transmission of HIV from those who are infected. We still have a long way to go, but I'm very optimistic that AIDS can be eliminated from the face of Africa.
HIV testing and counseling are entry points to prevention, treatment and care.
Plus tôt nous faisons le test,
the earlier you take the HIV test, the better. HIV testing helps determine whether or not someone has the virus in their body. Knowing your HIV status has two main benefits. Firstly, if you are HIV positive, you can take necessary steps before symptoms emerge by accessing treatment, thereby potentially prolonging your life for years. Secondly, if you know your HIV status, you can take the necessary precautions to prevent the spread of HIV to others. People whose HIV test is negative can be advised on how to reduce the risk of getting the infection and how to stay HIV negative. One can do the HIV test in hospitals, health centers, family planning services, or in private health facilities.
Ou encore les structures sanitaires privées.
I tseba hona tjena na boemo ba ka ke bofeng ke tla itlhokomela jwang ke tla ja jwang ke monate ke ho tseba hore na boemo ba ka ke bofeng
le mpehileng kwano le nna ke hore ke tlo tla ke tseba ka boemo ba ka hobane kgothaletso e ntse le hore motho a itsebe nako e sa le teng
ka 2003 le nna ka ke tla ke tlo tseba boemo ba ka mme nka fumana hore ke positive empa ke le ka moya.
J'ai fait des tests à plusieurs reprises.
I have been tested several times. My family and I have learned a lot. It has helped me come to my senses and improve the message that I deliver to the public as part of my work. I deliver a strong message because I've been tested. Being tested also helps me in educating my children.
L'éducation familiale avec mes enfants.